If I told you that 80% of people who suffer from bad breath don't even know the problem isn't their teeth, would you believe it? Hi everybody, I'm Dr. Mehrnaz, a dentist, and today we're talking about one of the most common problems out there, bad breath. Most people think brushing solves everything, but the truth is the main cause of bad breath is actually something we rarely look at, the tongue. On the surface of the tongue, especially the back part, you get this white or yellow coating, and that layer is full of bacteria. These bacteria release gases that smell awful, so if you wake up in the morning and your breath smells really strong, you can almost be sure it's because of the coating on the back of your tongue. This layer is made of bacteria, thick saliva, dead cells, and food debris. And the thicker it is, the worse the smell gets. So remember, cleaning your tongue properly is crucial because the tongue is the #1 cause of bad breath. Another reason, a decayed or infected tooth. Hidden cavities or half erupted wisdom teeth can trap food and bacteria and create a really strong smell. Sometimes the tooth looks fine on the outside, but behind it or between the teeth there is a tiny cavity that only shows up on an X-ray. That's why you should always go for checkups every 3 to 6 months. Next cause is dry mouth. When your mouth is dry, saliva, which normally washes away bacteria, drops and bacteria start multiplying like crazy. The mouth becomes acidic, teeth start decaying, and the smells gets worse. Dry mouth can be from stress, not drinking enough water, or breathing through your mouth. If you wake up with strong smelling breath, chances are you slept with your mouth open and your mouth dried out. And sometimes the problem doesn't start in the mouth at all. It's the medications. A lot of antidepressant, allergy meds, blood pressure drugs, and even some antibiotics cause dry mouth. Dry mouth means bad breath. If you started a medication and notice your breath getting worse, that might be the reason. It's nothing to freak out about. You just need more hydration to keep your mouth moist and be more consistent with your oral hygiene. Another cause many people never think about is gum inflammation. If your gums are red, swollen, or bleed when you brush, you probably have gum inflammation. When that happens, a small pocket forms between the tooth and the gum. Bacteria get trapped in there and release really smelly gases. What you do, you need to see a dentist and get a cleaning. Scaling removes the hard mineral deposits that push your gums downward and cause gum recession. A lot of people think scaling damages the enamel. Absolutely not. That idea is completely wrong. Scaling only removes the tartar. The tartar keeps pushing your gums down, causes bone loss, your teeth get loose, and eventually you lose them. All because you didn't do scaling. So please take this seriously. With just one scaling, you can bring your gum health back to normal. Now let's talk about something most people never pay attention to, the sinuses and the back of the throat. If you constantly feel mucus dripping down your throat, your sinuses might be involved. When sinus drainage drips into the throat, it creates a very specific, very strong smell that brushing or mouthwash can't fix it. In that case, you need to treat the sinus issue. Another big cause is acid reflux. When stomach acid comes up, gases and even bacteria from the stomach enter the mouth and create a sour, unpleasant smell. Reflux breath has a very recognizable odor, sharp, sour, almost like something burnt. And here comes one of the strangest causes that almost nobody thinks about, stress. When you're stressed, your body releases cortisol, and at the exact moment your heart races and your hands get cold. Your mouth also starts drying out. Not because you didn't drink water, because your body thinks it needs to be ready for danger and reduces saliva. And dryness is the perfect environment for odor-producing bacteria. So to summarize, the major causes of bad breath are the tongue, decayed teeth, tartar and inflamed gums, dry mouth, sinus issues, and acid reflux. It's time to say that sometimes you smell it, sometimes you don't. Sometimes you brush up, but the bad breath won't go. Sometimes it gets worse, sometimes it's light. Sometimes you wake up and it hits you in the night. 'Cause the microbes on your tongue are working where you're sleeping tight. And the moment you wake, the smell is gonna hit you bright. Clean your tongue, clean your tongue. Now, how do we actually fix it? Clean the back of your tongue with a tongue scraper. A toothbrush doesn't clean the tongue properly. Drink enough water. Keep a bottle of water with yourself and drink regularly. Use dental floss because the smell that comes from between the teeth can only be removed with floss. See your dentist every 3 to 6 months for checkups. If you have allergies or sinus problems, treat them. And if you wake up with a sour taste, burning, or bitter mouth, you need to control your reflux. Another thing people overlook is mouthwash. Mouthwash with alcohol dries the mouth and makes the smell worse. If you haven't had any recent surgeries, stick to alcohol-free mouthwash, so you protect your teeth without drying your mouth. At the end of the day, bad breath isn't something you have to live with. You just need to find the cause and fix it. And honestly, a lot of times bad breath is just a reflection of the stress you carry around quietly. So please, for your body, for your peace, be a little kinder to yourself. A deep breath, a few seconds of pause, these tiny things can work magic because your mouth is a mirror of your health.